Hi, this is Sangeeta Dhawla going to take you through the topic living with Alzheimer's disease. Alzheimer's disease? Heard about it earlier? We will take a keener look at what it is. What is Alzheimer's disease? Alzheimer's disease is a disease that progresses with time and destroys the memory and various other mental functions of the person. Alzheimer's disease is also called dementia. Dementia has no cure but worsens only as it progresses and finally ends in death of the person. This disease is diagnosed in people who are aged 65 and above, but there is no hard and fast rule that only these people be affected with this disease. Early onset also is possible in a few cases. This develops differently in different people. One symptom that you may find in one person may develop at a later stage in another person. Generally, what happens is that once we see certain kind of symptoms, we generally mistake them for being signs of old age or stress. One characteristic feature that people suffering from this disease show is their failure in memory of the recent events. They fail to remember anything that has occurred in the recent past. Once the diagnosis is confirmed, there are further tests that will ensure that the thinking abilities are also impaired because of the disease. There will be a lot of mood swings. The person will keep on repeating the same thing again and again, and there is every chance that the people who are associated with the patient may get irritated with this kind of a behavior. Initially, they may think that the patient is behaving so in order to draw their attention, but as the condition progresses, the symptoms also intensify and the person will slowly withdraw into his own cocoon. The body will cease to function normally and the person will slowly become bedridden. What are the various characteristics of Alzheimer's disease, or the more popularly called known dementia? The entire course of the disease can be divided into four basic categories. First one is the pre-dementia stage, where the initial symptoms surface. Here the systems have the ability to affect the daily living activities of the person. The person is unable to acquire new information, he is finding difficult with abstract thinking, and there is less flexibility and less attentiveness in the person. This is the first stage called the pre-dementia stage. Then comes the early stage. There is an increased impairment of memory. Dementia refers to loss of memory. So, as we are progressing from one stage to another, you see that it is the memory that is being affected very badly for the patient. This disease does not affect all the capacities of the memory equally. The person may be able to recollect things that have happened in the long gone past, but he is unable to recollect things that have happened in the recent past. But despite all these symptoms, he is able to perform his tasks independently. The third stage is the moderate stage of dementia. It is during this stage that his independence is hindered and the person is unable to perform his activities on his own, and his daily activities take a bad hit. And it is during this time that there is impairment of the long term memory too. There is a lot of resistance to caregiving. It is a fact that one has to keep a 24-hour watch on a patient suffering from dementia. If it is not possible for people to take care, they generally employ a caregiver. There are outbursts of anger, there are mood swings, there are spells of crying and wandering and irritability also shown by the person who is suffering from dementia. These symptoms become a cause of concern for the people who are closely related with the patient, and they strive to take all measures to make the person feel comfortable. The last stage is called the advanced stage of dementia. This is the final stage of Alzheimer's disease, and the patient is in such a state where he is completely dependent on the caregiver. The speech of the patient is reduced to monosyllables. There is exhaustion set in from all sides. The mobility is absolutely zero, and the muscle mass also deteriorates to the point that the patient gets bedridden. And because of this bedridden nature, there are a lot of bed sores developed, or this condition will soon end up in death, but how the person will die is different, not purely because of Alzheimer's. Alzheimer's is definitely a terminal disease, but the cause of the death could be pneumonia, could be pressure ulcers, could be the bed sores, but not directly Alzheimer's. What is the cause of Alzheimer's disease? We have learnt about the symptoms. We have seen the various stages through which the disease passes through for a patient who has been diagnosed with dementia, but we have to get to the root of the problem. What is the cause of Alzheimer's disease? Scientists believe that this disease is a combination of genetic, environmental and lifestyle factors which have a tremendous impact on the brain. Genetics is the main cause in less than 5% of the cases. The cause of this condition is not clearly understood, but the effect the disease has on the brain can definitely be studied. This disease has the ability to kill the cells in the brain, and when more number of cells in the brain are killed, the brain shrinks in size eventually. There are two abnormalities that are observed when a brain test is conducted of the dementia patient. They are called the plaques and the tangles, which are considered to be the hallmarks of Alzheimer's disease. When we are talking about Alzheimer's disease, we see that the patient is anyway suffering, but there is a heavy impact on the family also. So, along with addressing the concerns of the patient, the impact it is creating on the family, and the way the family members are tackling these after effects also have to be studied. There is no other disorder that places so much stress on the family members as Alzheimer's does. Caregivers play the pivotal role in the management of this disease. They routinely report stress-related symptoms. They complain that they are exhausted by the end of the day. They feel fatigued by the end of the day. They are often angry with themselves and end up feeling helpless about the condition in which their relative is in. The stresses they experience may have numerous sources. Very often, they will have to take over all the tasks that have been done by the patient so far. So, this is additional burden for them. They must keep a vigilant watch over the patient. Wandering is one symptom that these people may show at some point in time. When you relax and if the person wanders away somewhere, it spells a lot of risk. Caregivers often experience a great sense of personal loss and psychological loss. It is really difficult to see a very close person of yours undergoing these changes, from a pre-dementia stage to an early stage to a moderate stage to the final stage. It is a very pathetic condition, and the caregiver also experiences a lot of physical as well as psychological pressure. Some caregivers report that certain kinds of behavior are really stress provoking, but the task of the practitioner here is to draw the right kind of information about what problems the patient is having in everyday life and how the caregiver will have to tackle them, will have to react to these problems, so that the patient has a better kind of a living condition. There is also this burden of stress on the caregiver. A lot depends on how the caregiver is coping with the difficult conditions. When the caregiver is a strong person and he is confident of tackling any amount of pressure that the patient gives in, the coping skills would be great and the burden of stress experienced will be low. But when the caregiver does not have the adequate skills or strength that are required to tackle a dementia patient, the burden of stress experienced is definitely going to be very high. We have seen that in other diseases, the treatment is focused on the management of the disease, but in dementia, the intervention is focused on dealing with the pressures that the disease brings along rather than trying to cure or tackling the stresses of the caregiving process. As each patient will behave in a different manner, there is no generalized procedure, there is no generalized rule that can fit as a solution for all the patients. It is essential for the practitioner to take a very individualized approach, understand the state in which the patient is in, understand the kind of coping problems that the caregiver is facing, and then devise a plan accordingly and help the caregivers and the other family members also tackle the situation in a better manner. One thing that we need to keep in mind when taking care of a dementia person is that the different symptoms might set in at different stages. So, what is severe at one stage may subside at a later point in time. For example, a woman may at one point in the disease feel that institutional care is right for her husband, but there is her daughter who suggests that his stage is not so that he needs to be sent to a institution for further care. Later on, however, a woman at one point in time in the disease may feel she can work independently where in reality she cannot, but when the disease progresses, she will realize that she needs assistance, and again when she enters into the moderate or the final stage, she will very soon understand that cooking is not her cup of tea and she needs to rest. There are a few people who make it really difficult for the caregivers to give them the kind of support that is needed, but as the condition worsens, the resistance that is shown by the patient also reduces, and then very soon they will be reduced to staying on the bed. Dementia is one such case where the functional problems differ from one patient to another, and it is the caregivers and the family members that need to understand what the patient actually needs and see to it that it is done likewise. The family reactions also vary differently towards this kind of a disease. So, the clinician should not assume that these people are fully aware of what to expect out of the disease. This perhaps may be the first time that the family has registered a case of dementia. So, the clinician should first take some time out to explain to the members of the family and also the caregivers what kind of reactions they can expect from the patient and what kind of support that these people will have to extend to the patient. Determinants of the burden. Some families report very high levels of stress even though the patient shows very less behavioral problems. Others cope with the most severe changes but report less stress. This severity of behavioral and cognitive symptoms has not been a good indication of how much burden of stress that can be taken by the caregivers or how much stress the caregivers are experiencing. The most important predictors of the caregiver's degree of burden have been found to include how the caregiver manages the memory problems, manages the behavior patterns of the patient. Very soon, the caregiver gets irritated, or looking at the condition of the patient, or depending on the kind of relationship he shares with the patient, the caregiver also might develop skills of being very patient with the patient. With respect to managing the problems, when the caregiver is flexible and tries out new strategies, the kind of stress that is experienced by the caregiver is also reduced. Research has proved that when caregivers receive calls when people come home to visit, the kind of burden that the caregiver experiences is reduced. There is every chance that the caregiver feels isolated. Why? He is not going out of the house, he is not engaging in any kind of recreational activities because of the pressures of the patient at home. As a result, he may feel out of a group very soon. This may be psychologically taxing on his mind, and he may slowly end up in depression also. So, when we are talking about dementia, we are not just talking about the state of the patient, we are also bothered about the condition of the caregiver. This decrease in social contact may be highly stressful for the caregiver. So, when the caregiver asks for someone's help, he can seek their replacement for a certain while, go out, refresh and come back. This will definitely reduce the kind of burden he is experiencing. Seeing one's own kith and kin degenerate like that is definitely difficult. Difficult for the closely associated people, the caregiver and also the immediate family members. Now, how can the family cope with having a person who is suffering from Alzheimer's disease? The most important factor in deciding the direction of intervention is what helps the family is looking at. Rather than the clinician saying, this is what you need to do, that is what you need to do, the clinician should understand what kind of help the family wants to deal with the condition in which they are in. There are two errors that practitioners can make in assessing the family preferences. The first error is that the practitioner thinks he knows what the family wants. The second error is that he assumes that the families have enough knowledge about the condition and they have enough knowledge about the kind of help they are seeking. But remember, these are just errors. The best way to learn the kind of help that the family is seeking is to discuss with them the condition of the patient, the kind of problems the caregiver is experiencing and the family is actually looking at. Very few families know that there are agencies that can provide information of this nature. Very frequently, people get information in bits and pieces. So, it becomes difficult for them to add these together and then make these pieces of information to work positively for them. For instance, a spouse caring for her husband might have been told by the doctor to put him in a nursing home, while her daughter might suggest that her father is not so sick and she should not send him to the institution but keep him back at home. There are quite a number of advantages as well as disadvantages too of the various options that are available for the care of the patient. Having the patient at home is a kind of an advantage because you know what the patient is doing, but there is a lot of pressure on the caregiver and other members of the family that they need to be extra careful, extra vigilant and see to it that there is no truance on the part of the patient. He does not wander away anywhere. There are some cases when the family thinks that they know what they actually want, but here too the practitioner should interfere and then discuss things clearly with them and explore the various possibilities that the families can make use of in trying to help the person cope with his condition. Intervention as far as Alzheimer's disease is concerned is more for the caregivers and the families rather than for the patient himself. Some caregivers may be reluctant to admit that they need help and they want the patient to change. In some cases, counseling the patient might also help. You may be wondering what change can counseling bring about in a person who is suffering from memory loss? No, at least it can be made use of in the initial stages where the person can feel better in terms of his mood and does not feel more depressed. Stress management model is also considered to be another good intervention strategy for the caregivers as well as the family members. Initially, individual counseling for the caregivers is offered where he is made to understand how he should go about the entire caring process, where he is made to understand the other related problems with dementia. The family meetings also definitely help the people related to the patient tackle the condition better. There is a lot of social support that can be given to the caregiver also. Generally, when people come for such kind of sessions or group sittings, there are two questions they generally come up with. Is Alzheimer's an inherited disease? And what is the course of this disease? Now, even a practitioner cannot definitely say what the course of a disease could be, because one symptom arises out of the other and each individual case is different. An overall sketch can be provided to the caregiver. Overall, the caregiver can also be told what he can expect out of the disease, but there is no set pattern that A will give rise to B, B will give rise to C. In the initial stages, the families are under the impression that the person is behaving in that manner to draw the attention of the members of the family. Very little do they know that this is a progressive disease that the person has fallen prey to. Sometimes it is true that patients will ask repetitive questions to seek attention, but when he is a dementia patient, he does not have the ability to think on those lines. By understanding these limitations, the family can respond to the positive part of the behavior. Memory will fluctuate, and this fluctuation will become more intense as the disease progresses. This memory loss also is taken in a negative sense by the family members. They often complain that he remembers only a selective things, he remembers only the things he wants. But one thing that they need to understand, that there is nothing deliberate done over here, because things have gone out of the control of the patient. It is extremely essential that the practitioner patiently follows the different kinds of problems the caregiver is facing, the different kind of problems that the families are facing. He should not get judgmental, and at the same time take each case individually and give them the various plausible options they can choose from. The caregiver's frustration sometimes can be so high that the solutions are right in front of him and he is unable to see them until and unless the counselor points them out. Therefore, Alzheimer's disease is a challenge not only to the patient, but also to the people who are very closely associated with the patient. There are things like memory loss and wandering, so many other symptoms that make life difficult not only for the patient, but for the caregiver and the members of the family. Greater interaction with the practitioner will help people tackle the situation in a better and informed manner.